Hi and welcome back to the Men's Hub. We're going to be talking about managing and understanding prostatitis. It's a condition that many men have heard of but may not fully understand. It refers to inflammation of the prostate gland, so it's different from benign prostate hyperplasia and it's different from prostate cancer. It can cause significant discomfort though, and it can disrupt your daily life, and it's more common in men under 50. It can occur at any age. So the good news is that prostatitis is treatable, and understanding its causes and its management options can help take control of your health. Today we're going to explore different types of prostatitis and what causes it and how to find relief. Now, I actually got into this because of a friend who contacted me about a diagnosis of prostatitis, and he had had pain, recurrent issues in and around the prostate. However, whenever we understood the lack of physical examination and the difficulties that he'd had trying to get treatment, we actually found out he suffered from epididymitis, which is a very different condition. It's inflammation of the vessels from the testes to the penis. So it is important that you get the right diagnosis, and this is not something to have to hide about or be afraid of. Once you've seen one, you've seen them all. Now, when it comes to pathology, the prostate is this small gland located just below the bladder, and it plays an important role in producing seminal fluid. When the prostate becomes inflamed, it can lead to symptoms like pelvic pain, difficulty urinating, and discomfort during ejaculation. And there's 4 types of prostatitis. There's the acute bacterial prostatitis. So this is inflammation of the prostate that is because of bacteria, and it's caused by a bacterial infection which can be often sudden and severe. There can be chronic bacterial prostatitis, which is a recurring bacterial infection of the prostate. There can be chronic pelvic pain syndrome, and it's the most common form with no clear infection but significant pain and discomfort. And then there's asymptomatic inflammatory prostatitis. So this is inflammation with no symptoms, often discovered incidentally during tests for other conditions. Now, the causes include bacteria such as E. coli or other bacteria that can cause urinary tract infections, stress and muscle tension in the pelvic area. There can be an autoimmune or inflammatory response. There can be trauma to the groin area and lifestyle factors such as prolonged sitting or dehydration. Now, when it comes to medicine, quite often you're going to be given some antibiotics for the bacteria as a first line of treatment, and it's often combined with pain relievers and hydration. Hospitalization may be necessary for severe cases. If it's chronic, then long-term antibiotic therapy is often suggested over several weeks, and it's used to eradicate persistent infections. However, with the amount of bacterial resistance now to antibiotics, quite often herbal antibiotics are a much better option. If you're suffering from chronic pelvic pain, and since there's no infection, an antibiotic is not going to work, you're going to need anti-inflammatories instead. You might be offered alpha blockers to relax the prostate muscles and improve urine flow, and physical therapy is often prescribed for pelvic floor dysfunction. Psychological support to help address stress-related triggers are also going to be considered. And if you are suffering from asymptomatic inflammatory prostatitis, then it will require no treatment unless it's connected to fertility issues or fertility concerns. Now, when it comes to natural and functional approaches, for those seeking complementary options, natural remedies and functional medicine can support the prostate health and relieve prostatitis symptoms. Saw palmetto is right up there. It reduces the inflammation and it supports prostate function. So according to research in Urology 2020, it's effective in reducing urinary symptoms associated with prostatitis. Turmeric is a powerful anti-inflammatory. It can help alleviate the pain and the swelling. So studies in prostate cancer and prostatic diseases highlight its potential in managing chronic prostatitis. Pygium africanum is derived from African cherry tree, and it's effective in improving urinary symptoms and reducing inflammation. Stinging nettle root can support urinary flow and reduce inflammation, and often it's used alongside saw palmetto. And then from a supplement point of view, a flavonoid called quercetin with antioxidant properties is shown in studies to reduce pelvic pain and inflammation. When it comes to diet, I mean, a lot of this is repeated from some of the other episodes, but a diet rich in omega-3 fatty acids such as salmon, walnuts to reduce inflammation, zinc-rich foods such as pumpkin seeds and shellfish, and then avoid irritants like caffeine, alcohol, spicy foods, which can all worsen your symptoms. It's important to stay hydrated. It's important to try to understand pelvic floor exercises and to reduce the amount of stress in your life. Now, prostatitis can sometimes make men feel disconnected from their masculinity due to the discomfort or the difficulty that they have during intimate relationship. Reclaiming that connection through physical exercises such as engaging in regular exercise, spending time in communal spaces like saunas, and participating in activities that foster male camaraderie can really be beneficial. And those experiences around men can prepare you to go back and be with your partner, where you're more empowered to be yourself. There are steps you can take to manage this, so it's important to stay hydrated, upgrade your diet, try herbal supplements, exercise regularly, and practice stress management. And if you need to, seek support and make sure that it is checked out. A lot of the consultations with doctors at the minute are being done on the telephone. This is one where a physical examination would be quite helpful, and it's certainly not something to be shying away from. Alright, hopefully you find that helpful, and I'll see you on the next episode.